Hey guys, so we turned 28 weeks pregnant today and I'm sitting outside in the parking lot at my doctor's office about to go in and do my gestational diabetes test. So we'll see how it goes and we'll talk about it afterwards together. All right, here we go. About that routine gestational diabetes test that I just did. So honestly, people made it sound a lot worse than it was going to be when I asked other people that have done it what it was like. You know, I heard people couldn't get the drink down, that they were gagging, that it made them throw up, and that they felt like pretty much crap the rest of their day and just, you know, came home and pretty much slept all day. So I decided to do it on a day that I did not have to work, which I think, you know, was a good idea. You never know how your body's going to take it. But honestly, for me, it was a fine experience and I did not have any problems. So let's get started. So first of all, I went by myself this time. Dan did not come. I did know that I would have to be sitting there for an hour, and tomorrow we have a doctor's appointment. So I just said, you know what, I'm just going to get it over with. Then the doctor gets my results and everything like that. So what they have you do first is I checked in and then, you know, they called my name. I went back to the lab part and the lady had the drink already ready for me, just in a styrofoam cup, nothing fancy. She had me sit down and told me that I had 5 minutes to drink it. So I sat there and, you know, I was a little hesitant, but I took the first sip and it was fine. Like, honestly, it tasted like a high C punch, or, you know, just a very sugary drink, pretty much. I don't drink a lot of stuff like that, so it was kind of like a treat for me, honestly. It was not bad at all, but I did not have a problem drinking it. So then after I drank it, within 5 minutes, I could have chugged it, to be honest, but I just sat there and just sipped on it a little bit. Then she wrote down on this piece of paper that I have in the previous clip to return in an hour, and that was at 2:42, I believe it was. That's when I would be returning. So she told me, you know, go in the waiting room, sit down, relax, and then once it's 2:42, you can just come on back. So I said, okay. So I went there in the waiting room, and thankfully the place I go to has very nice, comfortable couches. They also tell you do not drink anything and do not eat anything and do not walk around during this hour. The only thing you're allowed to do is, of course, use the restroom, which I took advantage of. You know, so honestly, I thought going into it that I was going to be able to walk around, you know, pass the time, because an hour is kind of long, and I just had my phone to play with. So thankfully, I had my phone and my headphones, and that was able to occupy my time. So my suggestions for you are to make sure your phone is charged. If you have someone to go with you, awesome. They can keep you company, make the hour go by faster. That would be great. You can bring a book, a magazine, your iPod. Hey, what are we doing?
Doctor appointment.
What do we call it?
Baby day.
Baby day. All right. We're excited. Gonna hear the heartbeat.
Whoop, whoop.
Check back later. We're waiting for the doctor. We've only been waiting for
local celebrity now.
So you just saw that we went to the doctor for our 28-week checkup. Like I said, we are going every 2 weeks now, so that is kind of exciting. However, at this appointment, the doctor is running behind. So Dan was able to come to this one, and we had to wait about an hour, 30 minutes in the waiting room, 30 minutes in the actual exam room. So that was kind of a bummer, especially, you know, when you're pregnant, it's not fun to wait. You have to use the bathroom multiple times. I got hungry very easily, things like that. And then, of course, you know, Dan had to go to work after, so he was a little antsy. I was getting antsy, so that kind of stunk. But anyways, there is 6 doctors, I think about 6, 7, that I have to see within my practice, because whoever is on call that day is the one that will deliver our little baby boy. So this was the last doctor that I had to meet. So from here on out, we are able to pick the doctors that we see, and we are aware of which 2 doctors that we do not want, just for personal reasons, and also because, you know, they tend to run late, and mama and dada got things to do, right? We're very busy right now, so that's that. And I know things happen. I also work in the medical field, so it is what it is, right? We got our appointment in, and that is all that matters. So everything went well, and let's see, I got my results back from the glucose screening test, and they were perfect, so I'm all done with that, which is awesome. And also weight gain. What have I gained? So I was curious because I wasn't keeping track very well, and at my other visits they were just telling me I was doing well, but they weren't necessarily telling me how much I have gained. So since my first doctor's visit, I have gained only 9 pounds, which is good. You know, he said that was healthy and everything like that. So I was excited about that. I am eating lots of treats. However, I'm taking advantage of this. However, I am still working out, and I do eat healthy as well here. So we took our 28-week photos today, which you know, we do every so many weeks. We take more photos, so I will show some of those on here, and they turned out really well. Dan and myself got to do them together, so that was fun. And it's our Easter theme because we go with every holiday that is at that time of our pregnancy. So that's fun to document everything. Let's see. So the most exciting thing that happened at that doctor's visit was the Tdap vaccine, which is not very exciting at all. But anyways, that's why I have my little band-aid right here. Didn't hurt at all. Literally felt like nothing, but Dan already got his, now I have mine, so we're all set with that. Other than that, the visit was just very simple like the other ones have been. He just asked if I had any questions, how everything was going, if I feel baby boy kicking and moving around, which I never question if he's okay in there because I have had such a great pregnancy and he is constantly moving throughout the day. So I love the reassurance of that. You know, they also listen to the heart rate every time you go in. And so he did that last. And baby boy's heart rate was like 150 or 160-ish. It's starting to get a little bit lower than what it was when we first started. He was in like the 180s and then went to 170s, and now we're going a little bit down. So, you know, he's there, and my fundal height of my tummy is measuring just 1 centimeter under the average, which he said is perfectly fine, and with the amount that I have gained, that's what he expected. So that is awesome to hear. So that's pretty much it. Oh yeah, one more thing I did want to talk about is During our photos, I created a list of cravings that I've had throughout this pregnancy and, you know, funky foods that I have wanted to eat a lot of. So I just wanted to go over those really quickly. So these things are included from when I first started, you know, my pregnancy. And of course, pickles were my number one. I have always liked pickles, but the obsession got way, way, way worse. I was eating pickles on the go. I was taking pickles in the car. People probably thought I was crazy, but you know what? It is what it is. So pickles are my number one, definitely. That's kind of subsided now. But other than that, I have also been enjoying cereal, like little kids cereal, including Cheerios and Cinnamon Toast Crunch, Fruit Loops, you know, mix them all together in a bowl, and it is the perfect combination for this mama to be. Some healthy things, I guess, would be fruit smoothies, grapes. Baby absolutely loves grapes. Green grapes, red grapes, eat them every day as a snack. Super cold, and I love it. Some other things include pizza, which I was never a pizza fan, and I have been during my pregnancy. And also, what else do we got here? Ice cream. We have a custard place near us, so I like to go there, and Dan will always pick me up stuff from there and surprise me, so that's nice. And then also we have truffles. Fannie Mae has been my place to go. You know, we had Valentine's Day, my birthday, and a whole bunch of holidays pass, and for every holiday Dan would buy me some Fannie Mae chocolate. And so that was fun. I was eating, you know, a piece a night, so not going too crazy, but taking advantage of being pregnant, right? A couple other things I know were on the list. Oh, Portillo's. A place that I enjoy is Portillo's. And it's funny, all I like is the simple chicken tenders and french fries there with their barbecue sauce. And for some reason, that is just something that baby and I thoroughly enjoy. So that's a place that we like to go to when we can. And also, I know there's a couple more I'm trying to think here. Okay.
So what else do we have to do?
I hope that you enjoyed our 28-week update, and we will continue to keep you updated. So let's check out that baby bump, shall we? So here I go. I will move on up. Let's step up here. And here we are. Here is our baby boy from the front. So as you can see, he's getting big here. Getting big. Alright, you guys. So thanks so much for watching, and we will see you in our next video. Bye. Check out my lovely maternity scrubs. So, worked all day. Baby kicks the whole time. And I just wanted to say that I got my Tdap yesterday, and now my arm is killing me. But they do tell you that it will get sore. And it is more than sore. It is like ouchy. So yeah, that is not fun. Okay, goodbye. Say goodbye, baby boy. He kicked.